Hey, it's Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com, and today we're going to answer this question that I got yesterday. When do we do bracket repositioning if it's needed? And the terms of treatment timing and staging, I'll tell you the way I do it. Now, of course, anything that I mention in this video, I just want to let you know that I have way more content made on all the topics and all the main points I'm talking about. All you have to do is go within my YouTube channel, not YouTube in general, but the StraightSmile Solutions YouTube channel. Once you're in that channel, look for the tiny magnifying glass. It's usually towards the top right, and search by keyword. Whether you want to search by wire sequence or how to place a bracket or just straight wire in general, we have, even on our homepage of our YouTube, we have a straight wire playlist that has, I think, almost 100 videos in it. It's everything you need to know. You don't even have to go to a class. Everything you need to know is in there. Just grab yourself a Typodont and do the work. Anyways, I digress. But specifically, I'm just going to lightly go over how I do things, and just a quick shout out to the benefits of indirect bonding as opposed to direct bonding. Again, if you don't understand the difference, you should learn about it. Some orthodontists do IDB, a lot do DB just because we know how to do it. Yes, because we train full-time for another 3 years on how to place brackets. So, of course. But to be honest, sometimes we do indirect bonding. Why? Because it's only, direct bonding has to be done by the doctor, so it's managing doctor time. So if we do indirect bonding, then you could do 5 starts at 5 p.m. on a Friday, which you normally couldn't do. So that's why we do it. And also, hey, I'm pretty good at placing brackets, but sometimes I'm not perfect. Sometimes I just can't see, it's too dark, I'm standing on my head, or the assistants can bump it when they're light curing it. So the benefit of indirect bonding is that everything goes on perfectly. Now remember, not all IDB is the same, and I've had the pleasure, in some ways, of touring a lot of labs that use IDB, and I've seen good stuff and I've seen bad stuff. If they're not willing to show you the STL, or at least a series of photos of how the brackets are positioned before you approve that case, it is not digitized IDB, and that is the number one question. So when I work with doctors with StraightSmile Solutions, I always recommend certain companies that allow us to confirm the bracket position first, because I've seen some terrible work that's done with IDB, and they're selling you an arm and a leg, but you're looking at it, it's not right. So what's the point of doing IDB if it's not going to be perfect, right? That's the whole point. So anyways, if you're doing IDB, you shouldn't have bracket repositioning. So that's all I'm trying to say, is this should be a one-off. It shouldn't be a regular thing. If it's a regular thing, then you're not putting the brackets on right, which means you should be doing indirect bonding. But let's say you inherited a case, or you started a case and you're using direct bonding, and you're like, oh, I don't think these are right. When is the right time to move things around? Well, in general, if I see something that's just egregious, like obviously wrong, like it totally slid, I'm gonna fix that as soon as I see it. If I see something that's a little bit subtle, but I'm not totally sure if it's wrong, then what I'm gonna do is I'm gonna let the initial sequence of wires express themselves, okay? So I've got other videos about this, what this means, wire sequencing, deflecting wires, and all that. If you don't know what that is, you should definitely watch those videos in my straight wire playlist. But I'm gonna work through my sequence of wires. I'm gonna get myself up to 18 niti. I'm gonna let the 18 niti express itself and no longer be deflected. This is a deflected wire, right? It should be pretty passive. Once the 18 niti is passive, I'm going to do a full, thorough look of every single tooth and bracket position. And I'm also going to pull the patient into the conversation and say, hey, this is the point where we've done the major movements. There might be some spaces, there might be some issues with the bite, but in terms of straightening the teeth, we've done that at this point. That's what we've done already. We're not going to go back and move brackets around again. So if there's some tooth you just think isn't quite the way you want it, and there's a lot of art that goes into orthodontics. It's not just a science, it's also an art. So it's not wrong if you want to move those centrals up 0.5 millimeter. It's not wrong if you want to move those canines down 0.5 millimeter, Sometimes you can't because of the bite, sometimes you can. So I want to know the patient's opinion at that point, at that 18 niti passive stage. I'm not gonna put them even on the spot. I'm gonna tell them to go home, take some time, look in the mirror, ask their friends and family. The reason being is there's nothing that's more annoying is you get to the end of the case and you're like thrilled, patient's done. You're like, woo, we're done. Yay, patient out of the chair, debonding. Patient's like, doc, I don't really like the position of this. And you're like, what? Now you gotta go back, you gotta repo, you gotta work your way through the wire sequence, you probably have spaces, you gotta chain again, now it's another 6 months. If you caught that way back then, some doctors even give the patient something to sign saying, I am happy with my bracket positioning, will not be asking for any future changes. I think that's a little cold, but there's nothing wrong with that. It will honestly nip it so that they take the time to look at it now and to make an opinion now if they don't like something, and I want to know their opinion. I don't want them to be unsatisfied at the end of treatment and feel like they can't say anything, right? Okay. So again, we take a hard look. You also usually need to take a progress panel at the bracket repositioning stage because you obviously a lot of times you're going to be checking angulations to make sure the roots are all parallel. So that's what I do. 18 NITI, progress panel, give the patients a voice, a platform to go spend some time, check on their own. Everybody comes back with their opinions. I have my opinions, they have their opinions, and we do a longer bracket repositioning appointment, hopefully not too many, where we're going to move things around. Obviously, I just kind of picked some of these photos because you can see here that 8 and 9 don't look symmetrical. That's the first thing I'm going to look at. Do things look symmetrical? I like to see mirroring. Does this look like this? Does this look like this? Does this look like this? I'm also going to check bite and everything like that too. And if something's not symmetrical, I'm going to take a progress panel and I'm going to see, well, it kind of looks like the root might be going this way. Maybe if I, reposition that bracket a tiny bit counterclockwise, it might upright it, but it also might just be wear on the mesial and incisal, so I don't know unless I take a progress panel, right? So patient might see this and it's like, oh, this is wrong. Well, it could just be wear, but you're not going to know without that progress panel, right? So if it turns out the roots are parallel, I'm going to say, hey, this is just wear. We can do a fill here afterwards, or you have some pretty long teeth, so we might just be able to smooth them down. But that's why you want to have that conversation at that point, because if the patient did want the bracket repositioned, I'd rather know then, so I'm not losing time, than at the end. All right, hopefully that was helpful. Thank you.